You know, we all know what health disparities are. We've seen data. We know the data. But we are a silent voice in our communities. And the work that we do every day is equipping and empowering individuals with knowledge to be a part of their own health solution. So we don't need physicians, hospitals to tell us, wow, that we aren't adhering, that why aren't we eating differently? Well, man, one of the main reasons we're not eating differently is the reason that we have health disparities in this country is because of the economic injustice and inequalities that continue to persist for us, from transportation to housing to education to all the social systems and systematic structures that cause us to exist here in this country today, right? So until we start looking at the policies, and those are deep-rooted policies and structural systems that cause us to be at this place, when you can look at data that shows regardless of our socioeconomic status and education, we are still going to have the worst health outcomes as people of color. So that means we got to stand up and we got to make ourselves be the voice of change around this very issue.
All right.
So today I want to talk a little bit about one issue that has really been a persistent gap, not just in Cincinnati, but across this country, and I think you're going to hear more and more about it, and it's food deserts. Everybody know what a food desert is? Okay. So we have 3 major grocers in our nation. One of them happens to be headquartered in our city, Cincinnati. That's Kroger. Kroger has closed grocery stores in Cincinnati and across this country, and most recently in Memphis, they closed 3 stores. And most recently, as of yesterday, they closed 15 stores in Raleigh-Durham. However, different twist to it for them, they are transferring those stores to another entity they own, which is more of a convenience store. So the reality with convenience stores is it's processed food, high sodium, so it's still not healthy food, right?
That's right.
So we have an issue of food deserts that's impacting the level and the degree of chronic diseases that are killing us and causing us to leave here far too soon.
That's right.
So I say to you today that food deserts, and I'm going to pass out some information that you can take back with you to the communities that you live in, because I bet every community represented here has food deserts.
That's right.
Because it started many decades ago when big box grocery stores left our communities and left a desert with no method of support of economic viability for us in our neighborhoods.
Right.
So this issue is now become full circle, because we look at chronic disease, we look at the knowledge that we have, but my goodness, if we can't live with equality and having access to food, where are we in this country?
Right.
So I leave you with this thought, and I leave you with this charge. Not only are we needing to address the issue of health disparities, but we need to help our communities. We need to work together, regardless if we're a physician, if we are a bus driver, if whoever we are. We need to unite around these issues of people of color to demand an attention to the crisis that's killing us far too soon. And that is health disparities and the inequalities and injustices that continue to exist and persist in our country. So I thank you for this time. I thank Rainbow Push. I thank Congressman Davis, Nikki, for allowing me to talk today and for us to really continue to talk about these serious issues. But now we're at a point of urgency. It's time to activate. And it's time for each of us to stand up and do our part. So I thank you.